Welcome to The Hidden Load, the podcast where we uncover the unseen weight carried by the educators and leaders in medicine and explore how to lighten it. I am Dr. Santina or Tina Wheat. I am a family physician, an educator, a leader, and a coach. Each week, we will dig into the challenges that often go unspoken, from burnout and boundaries to purpose and identity to figuring out sustainability, and share practical tools to help you move from chaos to calm and from burnout to balance. Because the hidden load does not have to be yours to carry alone, and in fact, shouldn't be. Let's get started. Welcome back to The Hidden Load, the podcast where we talk about the invisible, unspoken weight that is carried by educators and leaders in medicine. The cognitive load, the emotional labor, the responsibility that doesn't show up on a schedule, but does shape everything that we do. I am your host, Dr. Santina Wheat, a family physician, an educator, and a coach. And today, we are going to talk about time management, but probably not in the way that you are used to talking about it. Because if you were an educator or a leader in medicine, I am guessing that you have already tried the planners, the to-do lists, the productivity hacks, the color-coded calendars, and if those things worked perfectly, then you wouldn't still feel like you were constantly behind. So today, I am here to offer you a reframe. Time management is often not our real problem. It seems like it, but it is not. The real problem is the hidden load and the lack of sustainable structures that are there to support it. And so this episode is for the program directors, the faculty, the clerkship directors, the educational leaders, the site leaders, the CEOs who are excellent at their jobs and also exhausted by how much those jobs require. Okay, let's start by naming the reality. Physician work, especially in education and in leadership, is defined by a high cognitive load. We have constant context switching. There is a steady influx of inbox messages. There are administrative tasks. There are so many competing priorities. In addition to that, we have fluctuating expectations that seems to only be getting worse lately. And then also unclear and ever-changing boundaries. And then often we have this pressure to prove ourselves over and over and over again. Sometimes we're proving ourselves to the people that we work with, the people that we're teaching, the people that we're leading, or our bosses. But then there's also that ever-present critic proving ourselves to ourselves. All of this being said, this is not a stable workflow. Many time management systems are designed for predictable and linear work. But we know that healthcare is not predictable and it is not linear. And in particular, if you're an educator, it is certainly anything but that. And yet, when we struggle through it, the message that we often hear, whether it's said to us or not, but the one that we internalize is, I must not be organized enough, or I must not be efficient enough, or I'm just not working hard enough. And then also, I must be doing something wrong. But here is the truth. If your job requires constant interruption, emotional presence, and rapid decision-making, doesn't that sound like every job in healthcare? Then feeling like you are time pressured, it is certainly not a personal failure. It is a structural reality. So I have had many days where everything looked reasonable on paper. I had my calendar nice and blocked out. I had time that was anchored for me. And whenever I have those days, they're often days that look tough but manageable. And then something goes wrong. It might be an interruption because something is going wrong with the system. Somebody didn't understand one of their tasks, or somebody walked in that we weren't expecting. Or there might be a learner who's having a crisis, or really is worried about that next test, or really needs to have a debrief in that moment. Or maybe it's from home. Maybe I'm getting an unexpected phone call that my kid is sick, or that they're worried about a test, or need something purchased for them. All of these seem to come out of nowhere. And all of these unexpected issues blow away my day. This has happened so many times that it feels hard to even give you a specific example because it happens at least once a month. And so, with that in mind, when you move forward and think through how can I have a reasonable process for time management, then we have to realize that there are going to be these unexpected things. And then we have to also let go of the myths that keep us stuck. So let's talk about those because these myths keep us trapped in frustration. So, myth number one, I just need to be more efficient. This is one of the most dangerous beliefs in medicine. And I think that you need to hear me say that efficiency does not equal sustainability. In healthcare systems, increased efficiency often leads to increased capacity. And that increased capacity gets filled with more work. Sometimes it's by our employers, sometimes it's by us. The reward for being efficient is rarely a sense of relief. It is usually more work and more responsibility. And that just doesn't work well. Because if you are constantly optimizing without protecting your limits, then you are not solving your problem. You are actually feeding into it. Efficiency without developing boundaries leads to burnout. And if you need a reminder about boundaries, then go back to episode number 3 and re-listen to it because we all need boundaries without the guilt. Okay, let's talk about myth number 2. And I will be honest, this is the one that hurt me the most early in my leadership. Myth number 2 is the sense that we always need to be available to be good leaders and good educators, or just good workers in healthcare. This belief is deeply ingrained in our culture, especially for those of us who are educators and leaders. But constant availability, it actually isn't good for us. It increases errors. It extends our charting and administrative time. It fragments our attention. It erodes our recovery. I know that availability feels like dedication, but the attention fragmentation that becomes of it is one of the biggest drivers of exhaustion. Being reachable at all times is not the same as being effective or being available when our teams need us. Okay, so the third and final myth for today is if I could just manage my time better, then I would feel in control. This is something that I used to tell myself all of the time, and I'm good at time management. And it sounds really reasonable to me, but this myth ignores the hidden load. It ignores the loads of the emotional labor, of the decision fatigue, and the responsibility for others' growth and well being. It also ignores the impact of carrying unresolved issues home because you can't calendar your way out of a system that continuously pulls from you without replenishing you. So, why does time management actually fail us as educators and leaders in healthcare? Well, here is the part that we just don't say out loud enough. Educators and leaders, we are doing 2 jobs, at least at once. You are managing the tasks and you're holding the people, the learners, the faculty, the patients, the team. And truthfully, most time management advice, it really only focuses on the tasks. It doesn't focus on the people. So then what happens? Well, you optimize your calendar, but you ignore capacity. Maybe you add tools, but you never remove expectations. Maybe you become more productive and feel like you're getting more done, but you actually feel less well. This is why so many high performing leaders feel quietly overwhelmed. They are doing everything right, but they're doing it in a system that was never designed for sustainability. And many leaders and educators are in a position where they feel isolated, so they're not able to talk about it. So let's talk about a different approach. Because if efficiency isn't the answer, then what is? Well, I'm going to tell you that I think the true answer, the most important tool, is prioritization. Now, this is not prioritization in a superficial way, but in a values-based protective way. And so one of the simplest tools that I recommend that you consider is the daily big three. And so what you do with the daily big three is take a moment each day and identify 3 things that actually matter today. You know that not everything can be done, so you're not identifying everything that could be done. You're not identifying everything that's expected of you, either by yourself or by someone else. You are just identifying 3. When you do this, this forces discernment. It shifts you from being reactive and feeling like you need to accomplish everything to being intentional and focused. So then, when new tasks come in, and we know they definitely will come in, you can then say, well, I have to get through my big 3. And then these new tasks, they have to go through a decision filter. And the decision filter is you asking yourself 3 questions about each task. The first is this just urgent or is it just noisy? Is this important or is it just expected? And if I do this, will this matter next week? Now, I'm going to tell you that these questions don't eliminate the work. They only help you place the work appropriately. Because here is the key. Prioritization is a boundary. It is saying yes on purpose instead of saying yes by default. Because what do you do if you say no to one of those questions? What if it doesn't pass your decision filter? Well, you have been able to tell yourself that it's not your priority for the day. And you can provide a response of, well, I'm not going to be able to get to this today. I might be able to get to it at X time. So I have found that this filter has really helped me. I used to think that somebody would send me an email and say, this is urgent. And what I would do is I would say, okay, that's urgent. I have to get to it. But what I wasn't doing was using the urgent or noisy request. And so what I started doing was asking myself the question and saying, does this really feel urgent or does this feel noisy? And if it felt noisy, then I would respond back to that person and say, hey, what does urgent mean to you? And I have found by using this little bit of curiosity, by checking in for whether it really was urgent or noisy, that sometimes their urgent was 2 weeks when my urgent was 10 minutes. And this just really provided an opportunity for space and sometimes for them to actually figure it out without me even doing it. I have also realized as I've gone through these filters that sometimes when I ask myself the question, will this matter next week? Sometimes the answer to that is yes, but it won't have mattered if I was the one to do it. And so that gives me the opportunity to delegate it to someone else
and allow it to get done, usually in a similar amount of time, but without adding an additional load to me. And then the person that I delegated to got the opportunity to have a win and to have an opportunity for growth. That is strategic delegation and something that we'll have to talk about in another episode. So I want to share a reframe with you about time management. Time management is not about squeezing more in. Time management is really about protecting what allows you to keep showing up. So what does that mean? Well, it means that recovery is not optional at all. It means that rest is not laziness. It also means that boundaries that are done well are not selfish, and that saying no is often an act of leadership. When educators and leaders are depleted, then programs suffer. Teams fracture, and learners feel it. But when leaders are supported, they are regulated, and they are well, then programs thrive, teams feel safer, and learners grow more effectively. Because your well-being is not separate from your leadership. It is foundational to it. And so this is not only important for us as leaders and as educators. This is also an important strategy for us to teach our learners and our teammates. Why? Well, because these challenges are not going away in medicine. An easy thing to do as a leader or as an educator is to demonstrate for your teams how you do your prioritization. This allows them to think through how they can also effectively triage the tasks that they have to make sure that they are doing the things that are going to have the most impact. When you can demonstrate that, then we are able to demonstrate sustainability to our next generation of leaders and educators. Now, if you have been listening to this episode and thinking, time management isn't really my issue. It's capacity, boundaries, and alignment. Well, good for you, because you are not wrong. Those are typically the challenges that we have when someone says that they are struggling with time management. That is why I focus my work on helping educators and leaders create sustainable systems and not just better schedules. If you would like to explore this more, don't forget that I have a couple of free resources that you can use. The first is my 7-day boundary challenge. This allows you to start developing boundaries without guilt in small, doable steps that fit a real life in healthcare. Or if you are thinking that maybe your purpose and alignment are off, then you can also access my free 15-minute alignment check. This allows you to determine if you are spending your time and energy in ways that match your purpose or if something needs to shift. Both of these links can be found in the show notes. And did you know that you can now get continuing medical education or continuing education credit for listening to this podcast? You can also find the link to the Pinnacle app in my show notes, or you can go to claim your free CME. Now, thank you for carrying the hidden load. Thank you for leading. And thank you for being willing to question the narratives that no longer serve you. I will see you next time on The Hidden Load, and I hope that you will reach out and let me know what topics you would like to hear and what has been meaningful to you. Take care.
Thanks for joining me on The Hidden Load. Tag me on Instagram at Dr. Tina Wheat or email me at santina@santinawheat.com with your takeaways and ideas. Don't forget to subscribe, and until next time, let's lighten your hidden load.